Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Because
therapist.
we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Strong glutes and back pain. Basically, we're talking about a correlation there, Brad.
Sure.
3 exercises that fit back pain and weak glutes in 5 minutes.
This is a short little convenient exercise program that does exactly what it says. But
if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. Today is the transition day, so we will start with a new thing tomorrow.
Okay.
And I'm going to tell you right now, Brad, it's going to be a mattress.
Oh, it is?
Yeah, so we're giving away a mattress and a couple of pillows, so a big deal. You can also find it on Facebook, the contest that is. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of Bob and Brad a day.
Right.
If that's all you can put up with us. So.
Bob, glutes. The strength of our glutes has something to do, or if you have weak glutes, a lot of times those people do have back pain.
Yeah, because you're not transferring the strength to the glutes, when you're lifting something like you should. Your back is doing more of the work.
Right. So it's all related,
they're all tied in
but
together.
Not directly. But why do we have weak glutes? And this is a really key thing, is if your hip flexors, the muscles in front, the opposite muscle group, is weak or tight, that prevents the glutes from firing, and that's reciprocal inhibition, which is something, if you're a therapist, you're very, very familiar with.
Lower cross syndrome, it's also known as. And also, what causes your hip flexors to be tight, Brad?
Sitting. A lot of sitting, which is pretty common in today's society.
We've become a sitting society, and therefore you get tight hip flexors, and therefore you get weak glutes.
Right.
I think gluteal amnesia, there's another word for it.
Yep. There's all these buzzwords that a therapist know. It's that common. So the exercise program we have, again, 5 minutes. And after you do this a little bit, you'll probably get faster than that.
Yeah. And what we're trying to do is basically cure all the problems.
Right.
We're trying to get rid of the tight hip flexors. We're trying to strengthen the glutes. And we're trying to do one exercise for the back, too.
Exactly. And that's a key one that I think is really the third one. You need to get that one in. So should we start?
Yeah, let's start off.
People are saying, come on, quit your babbling.
Do you want me to do the first one? Or do you
the hip flexor? Sure, go ahead.
So you're going to get on, you can lay on a surface like this, you can do this on the bed. You can scoot toward the end of the bed. Make sure your shoulders are well on the bed, though. I don't want anybody falling off. And I'm going to stretch this hip flexor. So I'm going to bring it down like this, and I'm going to lock this one up, lock the pelvis up in place. So now I'm stretching this hip flexor right here. If I let my knee bend a little bit more, it stretches the quad too a little bit, and the hip flexor. And you could just lay like this, and it will, over time, stretch out.
Yep, just gravity. Now, there's another way we're going to show you this without laying on the bed on your knees, so just hold on.
Sure.
Make sure you do both sides.
Yep.
Both legs.
Flip around and do the other side.
You're going to hold that, up to 30 seconds, 2 or 3 times.
Yep.
And just let it relax. You may find that one hip is tighter than the other, depending on how far
Very often you will find, I think, one hip is tighter than the other. Do you want me to show a kneeling down too?
Sure, Bob.
Do you want to give me the pad?
Yeah, you can use a pillow or a pad. If you got carpet, you may not need it. It's just a comfort thing for your knee is all.
So I'm going to stretch this one. So I'm bringing it forward like this.
Yep.
Now, if you want to do a couple little different twists to help this, one, you can take your hand and push forward like this.
There.
Look how I have good posture while I'm doing this.
Up and down with the shoulders. 2,
you can take your ankle and move it out away from the body like this.
Right.
Internally rotates the thigh a little bit. And now I stretch it, and it stretches just the muscles a little bit more.
So you can hold and relax, hold and relax.
That feels good, Brad. 5
to 10 times. If you want to hold, do you normally do this one, hold it for a long time, or do you go on and off?
I'll do a little bit of both.
Okay.
I go like this, and then I'm watching the news, and I start doing a little bit of stretching that way too. So, and I of course do both sides.
You bet.
Otherwise, I'm going to walk around.
And circles.
In circles.
Yeah, like a duck.
And like a duck. A duck, swimming duck maybe.
Oh yeah, with one leg.
Yeah, with one leg. We'll get it eventually. All right, Brad, what's the next
So
exercise?
that takes care of the first one, hip flexors. Figure out which way you like to do best and do that. That'll take you about a minute to 2 minutes. The next one is then we did this problem. Now get those glutes stronger.
Get those things firing.
Yep.
Get
So
those things working again.
options you can do. This does work better on the floor, carpeted floor. You can do it on the bed, but it's not so good. You need a firmer surface.
Just for instructional versions, we're going to show you on the bed here.
Right. So we want to think about squeezing those glutes together and lifting the hips in the air. We call this bridging, and we're going to do a set of 10. If this is too easy, the way you make it, you get down to 10.
A little more challenging.
Yeah, more challenging is put one leg out and do it again. And make sure you do both legs.
And squeeze your buttocks together while you're doing this.
Yeah, it's like
pretend there's a quarter in between your cheeks and you're trying to hold it there.
Every therapist knows that, I think.
Yeah.
That little saying to your patients, especially after a surgery. Now, Bob, I have a hamstring issue. My hamstrings feel a little crampy when I do that. So the way I do these at home is I take an exercise ball and put my feet on it. Or you can use a stool. Works just as good.
An ottoman, maybe.
Ottoman, there you go. Have your wife go down on her hands and knees and put it on her back. I'm just kidding. My wife would kill me if I heard that. But if I keep my legs straight, that eliminates that potential for hamstring cramps. And I think you actually get a better glute set this way. And what I do is I put my fingers on my core and then I make sure my stomach is tightening as well, so I get a double benefit from this. And I'll do 10 to 12 of these. Oh, they're wonderful. And then you're done.
Yep. So very quick, you can go, you can go from the stretch right into that, and then you finish with the extensions. You want me to do them?
Yeah. You do that. So when you get done with those,
you can just flip around on your stomach.
Yep.
And you can have your hands below your shoulders like this. And usually what we have people start off with is little micro press-ups, we call them.
Yeah.
So you're going to just kind of press halfway up. You're keeping your pelvis on the ground or on the floor. You don't let it go up like this.
No.
If your back is so tight that when you start going up like this, it starts coming up, that's all the farther you go up. You keep working in that range until it loosens up.
Right.
Eventually, you want to get higher and higher and get more and more motion in the lower back. The reason we're doing these is most of your day is spent sitting, which you're rounded out this way, or you're bending forward. You're doing something. You're bending the back forward.
Right.
Almost nowhere time during the day are you reversing that curve.
Right.
And so your back gets very tight and it becomes very painful after a while if you continue to do so. So
I was going to say, this also does stretch out the hip flexors, so you get a double benefit.
Exactly. Good point, Brad.
The reason I jumped off the table is I have spondylolisthesis. If you have that condition, which there are about maybe 5% of the population that has that, you probably will not want to do this because it's irritating. Or if you have lumbar stenosis.
Spinal stenosis,
Yep, you'll probably not want to do that. Majority of people will be able to do this. Typically, if you're 60 or older, those people sometimes are going to have that stenosis problem.
If you're 60 and over, you can do some of these.
Right.
You can just work more of the mid-back up and down and get some motion that way.
Repetitions on those, 10 is enough to do, and that'll be fine. We took more time just so you did it properly.
Right, exactly, because we had to explain. But after a while, you may want to do more than that initially. You may want to do a set of 20, but later on for maintenance, you can definitely get by with just 10.
Exactly. So, if you do want to complement this, just going out and walking can be a great thing for the hips, everything involved. And so after this, if you wanted to, go out and take a 20-minute walk. And
you can never go wrong with a walk,
right?
Because it's good for your entire body and your mind.
Right, exactly. So take care of your body, take care of everything you have.
And remember, Brad and I can fix just about anything
except for
a broken heart.
But we're working on that as well. I don't know if this trio of exercise is going to do anything for your heart, but
I wonder how many years we can say that we're working on it, and people will still believe that we're working on it and that we're doing.
Well, Bob,
something.
we're gonna have literature on this. We're gonna have
we're
something
gonna be published.
We're gonna be published and we'll be famous at that point.
Yeah, that's right.
Take care and enjoy.